stage we're at now is we've gone, the strategy's been published, and we've asked people that have involved in health and social care to provide us ideas that could be made into pilot schemes to test out new ways of working. Test out new ways of working in terms of different pathways, different people working together, multidisciplinary, different funding mechanisms, which might incentivise different ways of working for both doctors and GPs and also patients, and something that can really benefit the whole community. So, supporting workforce transformation and managing to keep the skills that people have got and also improve the skills that people have got is very important. And then being able to find out what the benefits are and have something measurable that we can prove as a positive outcome that can be scaled up to the size of, potentially be scaled up to the size of, to be rolled out in Jersey and help both the health and social care system and the patient. So these are the kind of criteria that we'd be looking for. So we've got ideas coming in now. We initially put out an advert and the JP, and the emails went out via Jim and a number of other people, all the board members, around about the 18th of January, more or less, I think, something along those lines. And then, yeah, we've got ideas coming in now, and some of them are really interesting. I'm hoping we might get some really positive outcomes. So what we're actually looking to achieve is we're going to look to get all these ideas. We're looking for quite broad ideas at this point, things that don't have to be really in-depth scopes, just a proposal of a new pathway or a new mechanism that might be able to help take things forward. So we're looking for up to 5 pilots. They say up to 5. It's not prescriptive because it depends on how big they are going to be, how difficult they are to implement, and obviously the resources that we've got. So it might be a little bit more, it might be a little bit less, but in theory, say up to 5 pilots, which is consistent with the principles of P82. So safe, sustainable, affordable, integrated partnership, and patient-centred primary care systems. Any professional team or organisation can propose it and also lead it. So we've got ideas coming in from GPs, from pharmacists, from optometrists, from voluntary sector, and we're just encouraging the people that are involved in delivering the care to come up with their ideas, the kind of ideas that people might have their own grumbles, but don't have their opportunity to say something and makes a difference. So we're hoping that we get some really positive outcomes from this. And the idea is that the pilots will vary by patient group, service, and the kind of people delivering, skill mix, and payment incentives. So, changing different ways of payment, will that mean that us as patients are more likely to go and see the doctor, or the doctor can employ different people within their practices to ensure that the patients get the best care for the best possible price, and all those kind of factors that are involved. So this is where we are. Based upon that, we're at the call for ideas stage. The closing date is the 23rd of this month, and by that time we identified an independent panel which are going to shortlist the initial ideas, at which point they'll be scoped up properly rather than just an idea, and they'll be evaluated on a similar set of criteria after about another 6 weeks. So middle of April we're looking for to come up with a final selection for these pilots, and then the amount of time that it will take to implement the design and actually put things in place. We'll have a pilot's implementation member of staff at that point who should be able to focus and really craft the pilots into proper schemes that go forwards. So the kind of things we're asking for are: what is it? Who's it for? Why do we think we should do it in terms of benefits to the community, to patients, to the system in general? Who would provide it? In terms of submitting an idea, the ideas are all coming, at the moment they're coming to myself by email, but they can be in any format. Because we're just looking for ideas, we're not saying this is an application form, this is what we want. If you can provide an idea that sets out those kind of thinking and the kind of criteria that are involved, we don't really mind how it comes in. There is a document that probably has gone out, I know Jim sent it, that details all the things we talked about, and the criteria and the themes that should be considered in that submission. As I said, no need to be a detailed basis case, and we're using the e-portal attendance.gov.je purely as a means of communication, and to myself by email. So the criteria will be benefit to patients, impact on the social care system, staff working, workforce, team development, multidisciplinary working, value for money for both patient and the community and the system, potential to test out different payment mechanisms, safety, and quite an important one, scalability for Jersey. We want something that's going to affect enough people that can enjoy the benefit. We don't want to choose a pilot that has 5 people that suffer from a particular illness, because in terms of the benefit that we can show, in terms of especially the community moving forward, we want something that we can prove is big enough to have positive outcomes. And ease of implementation. So yeah, ideas are going to be shortlisted, developed in more detail, and then final decision will be made on which ones will be taken forward. Those are my contact details if you do want any more information. Jim has that document already, but I can also certainly send it out again. If anybody does want to leave their email address with me, I'll make sure you get those documents.